All right, let's have that discussion for you. Reaction to what's likely to take place today. Welcome, Dr Mvuyisi Mzukwa, who's the chairperson of the South African Medical Association. Doc, thanks for your time and your patience as we give this conversation a second jab. I was hoping to gauge from you just where SAMA stands on the spectrum of reaction we've received. I mean, on the one hand, of course, government itself is saying that this will be a vehicle, if you like, to try and improve the country's health systems. But on the other, there are real concerns that it paves the way for the implementation of the NHI, which has serious defects. Where does SAMA stand?
Good morning to you, and good morning to your viewers. Thank you very much for the opportunity. As you know, we've been supporting. In fact, we are in support of the overarching goals of the Presidential Health Compact. We've been part of it, and we've been leading Pillar 5. These goals, they emphasize the health system strengthening. It also talk about enhancement of the health infrastructure. It talks about equitable distribution, which are things that we really support. But the challenge is that it makes so much reference to the NHI, and you know that we have a serious problem with the current form of the NHI. So because it was not separated, I think the problem was that there was no separation between the current presidential compact and the NHI. So they wanted, to put them together. And in that document, it says that we support the NHI, which is something that we don't in its current form, because of the reasons that you have stated before and are known to the public.
Safe to say then that SAMA won't be backing today's signing ceremony then?
No, SAMA, as the chairperson of the association, I should be there if we're going to sign. But since we've taken that stance and we've consulted with our legal team, and the advice was that it would be a mistake if we sign this a document, especially if we still want to challenge the NHI, because it makes so much reference to it, and we don't support the NHI in its current form.
Yeah. The concern, of course, is that it seems government is forging ahead nonetheless. Busa, for example, has also threatened to boycott the signing ceremony. I'm not sure if they're going to send a representative or not. But the point really is support of these groups or not. It seems the presidency, at the very least, is going ahead. And that raises real concerns about the amount of backing any kind of initiative will have in the context where the buy-in doesn't seem to be as widespread as it should be.
Ayanda, what we've been always advising government when it comes to policy issues, we've been saying to them they need to co-create with us so that we co-understand and we can, work together on these issues. And what they've been doing is that they've been pushing this for political reasons. Hence it was signed publicly by the president into law a few weeks before the elections. It was not meant, for what is supposed to. It was meant to recover political gains. So we don't want to be part of that confusion. Because the issues that you are raising in the NHI is that even though we've got, we support the objectives of the NHI, but in its current form, it does not talk about the issues of socio-economic and environmental health determinants. And it just negates all other things. The infrastructure, the dilapidating infrastructure, it does not talk about availability of water in the rural areas. You can't just take money and throw it in the healthcare sector without attending to the issues of ethical leadership and governance. We know that we've got a serious problem of ethical leadership and government. This has been an issue that has been highlighted by the Academy of Science of South Africa, ASEF, which advises government on this issue, that even if you have this implementation of the NHI, in this current environment where you've got people who are just buying in skinny jeans and there's lots of corruption and stuff like that, and there's acting officials almost everywhere. Go to the Eastern Cape, is acting this, acting that, acting this. So those are the issues we're saying. Without working on those matters, you can't implement this, in that environment. And we thought it was obvious, to a government that would want to listen, to healthcare workers.
Yeah, I suppose you've answered this question in some ways, but what then do you reckon is the objective with today's signing ceremony? I mean, are you just seeing this as nothing but political expediency?
Well, when you don't have a buy-in from professionals and some sectors of society, especially the healthcare sector, because if we're talking about the South African Medical Association, we're not just a representative body of doctors in the private sector. It's both public and private. So this narrative that it's only doctors that are in the private sector that are objecting to the NHI, it's actually a fallacy. And we know that, we are a huge or one of the largest associations in South Africa, and the only one that is represented in the World Medical Association. So when we utter these issues, we come up with these issues, we're informed by what is happening at an international level. And we support the goals at that level. But when it comes to this, there are issues that we think need to be ironed out before we can talk about, such issues such as NHI.
All right, Dr. Mvuyisi Mzukwa, as always, thanks for speaking to us. The difficulty, of course, is that, there are real concerns being raised, but the train is very much on the way, and one wonders what lies on the other side of today's signing ceremony. Nonetheless, we appreciate your giving us your view. Dr. Mvuyisi Mzukwa is the chairperson of the South African Medical Association.